Hi, Tan Sri. There's a report claiming that PPEs are not reaching healthcare workers in the Sabah interiors in time, that they have to buy their own or source their own while waiting for the ministry supply. Can the ministry confirm this, and how is this issue being resolved? And my second question is, previously Sabah positive rates were much higher than the nationwide positive rates, but now it is closer to the nationwide positive rates. Does this indicate improvement in the situation in Sabah?
So I answer your second question. Certainly it shows improvement because we have done the activity for the last 2 weeks, public health activities we have done. And even before the election, we have tightened the border control, which means, for example, working with the Angkatan Tentera Malaysia, Polis Diraja Malaysia, roadblocks has been actually implemented and tightening the border control for those undocumented migrants. So that has been done. Our activities also have been done earlier, but we have not announced it in terms of mobilization of our staff, equipment, etc. to respective hospital. For example, I just use example of Hospital Sempurna. The OT operating theatres, I mean, we have upgraded. Now they have used the OT for operation, so we do not need to send the patient to Hospital Tawau. We also have a positive ventilation room to treat a COVID patient. So all that has been put in place, planned much earlier. It's not overnight that we get this OT running as well as the ventilation room ready, but it was well planned. So I do not see where it was the flaw, because I echo the same statement made by Pengarah Jabatan Kesihatan Negeri Sabah, Datuk Christina, saying that she is monitoring the whole situation in the hospital and clinic. There's no shortage of PPE. The PPE that we have, we monitor from here and also from the state, lasts for 29 days. The minimum is 29 days, but we do have emergency procurement. So 25 million has been given to procure only PPE, because we are thinking of not the short term but also long term. So procurement has been done. And also we have a guideline for the usage of PPE published on the 21st of April 2020. And we hope that those working in, for example, ICU, working in a COVID ward, they have to wear the PPE, the full PPE. But those in the field, there's a requirement, so we follow the guidelines, and that the guideline will protect them. So I do not know where these rumors comes in, and which hospitals that is actually short. There's no mention of the hospital, no mention of the name, and etc. This is just perhaps just a fake news. Why not refer to Jabatan Kesihatan Negeri Sabah, refer to us, then we can tell you in terms of our monitoring. So we can see our monitoring in terms of the usage of PPE in a respective state as well as the whole district.